Hello and welcome to this lecture. Today we are going to discuss bronchiectasis and we are going to present the case of a patient who was a 29 years old woman with cystic fibrosis diagnosed at birth. She became colonized with microorganism P. aeruginosa in her earlier 20s and had exacerbation once or twice a year. The learning objective for today's lecture is to define and discuss the etiology of the disease, understand the pathogenesis of bronchiectasis, recall the morphological and clinical features of the disease. So it is defined as the permanent dilation of the bronchi and bronchioles caused by the destruction of smooth muscles and the supporting elastic tissues, as they are made up of the bronchi and bronchioles are made up of elastic tissues and result from associated with chronic necrotizing infection. So it can be occur in with different microorganisms, like in the case study that we're discussing, it is caused because of the P. aeruginosa, and it is associated with genetic factors. So what happened, the main thing is that it is congenital and heredity associated with cystic fibrosis, or it occur in patient having immune deficiency state, or because of the pneumonia or necrotizing infection. And if a person having atopic asthma or chronic bronchitis, and patient having bronchiectasis as well, it may worsen the asthma and bronchitis. So it means that if a person having multiple disease, or if a person is allergic, or if a person having asthmatic disease and then he is suffering from bronchiectasis, then it may worsen the asthma. So the patient that are already asthmatic need to be take care more than the normal patients, and they are also responsible for bronchial obstruction. So that is another reason why patient need to take care more. The pathogenesis, it result in obstruction and chronic infection caused by the microorganism. For example, obstruction caused by foreign body impairs clearance of secretion, providing a favorable substrate for superimposed infection. So the main thing for the disease is the pathogenesis is the microorganism like P. aeruginosa. That result is inflammatory damage to the bronchial wall and accumulation of the exudate and causing disintended or destruction of the smooth muscles or elastic tissues and leading to irreversible dilation. So that is why patients that are asthmatic having bronchiectasis need to be more careful. So when we take a look of the bronchiectasis, it usually affects the lower lobes, and airway may be dilated as much as 4 and 5 times diameter. So you can see that that how much dilation occur, and if the dilation occur 4 to 5 times, then it can permanently damage the airway sacs. We mentioned typically mixed flora are cultured from sputum, and when we take the sputum of the patient and we culture them through agar plate, cultural plate, we grow them, we found the formation of presence of staphylococci, streptococci, pneumococci. These are all microorganisms. Anaerobic bacteria or microaerophilic bacteria, especially in children, or the presence of Haemophilus influenza or Pseudomonas aeruginosa. So again, to diagnose the patient, we need to see the sputum, we need to culture them, we need to see which microorganism will be affected, and usually they affect the lower part of the lobe. The clinical features consist of persistent severe cough with presence of mucopurulent and sometimes fetid and sputum. Dyspnea, rhinosinusitis, and hemoptysis are the clinical features that have been observed. So thank you so much for today's lecture. Hope to see you again.